Welcome back, everyone. The Alzheimer's Association just released a 2021 Alzheimer's Disease Facts and Figures report. This report provides an in-depth look at the latest national statistics on Alzheimer's. This year, the report is tackling Alzheimer's as it relates to race and ethnicity. I spoke with Alzheimer's Association New Mexico Chapter Program Director Denise Parras to take a closer look at this year's report and all of its findings. Joining us this morning, we have Denise Parras. She's with the Alzheimer's Association New Mexico Chapter. Good morning.
Thank you, Crystal. Hi.
Absolutely. Denise, thank you so much for joining us this morning. A very important conversation that we're having this morning because national statistics just came out, and the report has some alarming numbers. Let's start there.
Sure. Our facts and figures report, our annual report that's come out, has told us what we already know, that the burden of Alzheimer's on individuals and families continue to grow. More Americans are living with the disease. Right now, we're looking at over 6 million that are affected by Alzheimer's and dementia. Right now, we also have about 11 million Americans providing that unpaid care for people with Alzheimer's. And that includes a rising number in what we call the sandwich caregiver or sandwich generation, where individuals are trying to care for their maybe their parents as well as manage their own smaller children.
Why is this report so important?
Well, the report is important because what we found with our special report, Race, Ethnicity, and Alzheimer's in America, that discrimination is a barrier to Alzheimer's and dementia care. We also found out that people of color want healthcare providers who understand their unique experiences, backgrounds, and many doubt that they would have access to culturally competent providers. So what we want to do with our work is we want to make sure that we're working hard to build trust and address these health inequities through our partnerships with healthcare systems and organizations that represent these diverse communities.
Were you guys surprised to hear that the numbers rose so high?
Well, no, here in New Mexico, we're looking at about 43,000 New Mexicans impacted by Alzheimer's or dealing with Alzheimer's disease. And the impact on their families is looking at about, 85,000 New Mexicans that provide, hours of unpaid care, and that continues to increase, and then the cost continues to increase, or the value of the care is looking at about 2.5 billion. And so these statistics show that we have to keep working hard to advance new treatments that can stop or slow the progression of Alzheimer's, while we continue to provide care and support services to all of those that are affected.
I know you mentioned there's a distinction between race and Alzheimer's, is what the report is actually showing. What is the Alzheimer's Association doing to try to help address this?
The association is committed to reducing health and healthcare disparities, particularly as they impact people's ability to access high quality dementia care. And again, just working with those health systems and organizations to help represent these diverse communities.
I know we have a lot of people in our population that are dealing with this, as you just mentioned, dealing with Alzheimer's. Either they have it or a loved one does. Where can they find resources if they need the help?
Well, they can always call our 24/7 helpline, 1-800-272-3900. And that's if you are looking for, if it's not always just a crisis line, but it's always if you're just looking for some advice, you do have someone you need to talk to, whether you're a caregiver or the person impacted with the disease. You can always visit our website at alz.org/New Mexico for local resources such as education programs or support groups.
Now, I know that we've mentioned before that while the numbers are large, it's likely the numbers are even bigger because there's people that have not been diagnosed. To those who think they may have some symptoms, where can they go to get more details on that, or should they consult the doctor first?
Yeah, you always want to follow up with your primary care physician if you're concerned about memory care issues for yourself or for a loved one. You definitely want to rule out any other conditions that could mimic symptoms of dementia before going that route. So it's always good to follow up there, and then referrals to specialists and that sort of stuff. But it's always good for your starting point to be with your primary care physician.
Awesome. Denise Parras, once again, thank you so much for joining us. Great insight you gave us this morning.
Thank you, Crystal.